You wake up, and the first thing you feel isn't energy. It isn't a readiness for the day. Instead, it's that familiar, sandpapery feeling in your mouth. You reach for a glass of water, hoping to wash away the night, but deep down, you wonder, is this just what getting older feels like? We've been told for decades that aging is a slow, inevitable slide. We're told that the heaviness in our legs, the foggy brain in the afternoon, and the fluctuating blood sugar numbers are just part of the deal once we cross 60 or 70. But what if I told you that one specific, everyday habit is actually aging you faster than nature intended? And the most surprising part? This habit is something you probably think is helping you. I'm talking about how you drink your water. It sounds too simple, doesn't it? But the science for those of us over 60 tells a story most doctors never mention in the exam room. Today, we're going to break down why your current habits might be choking your circulation, shrinking your memory centers, and putting a tax on your heart that you don't have to pay. The plain water trap. Most of us were raised on the idea that water is water, but after 60, your body plays by a different set of rules. Research shows that drinking plain, room temperature water can actually slow down your effective blood flow by as much as 79% compared to optimized methods. Why? Because as we age, our plasma volume drops and our red blood cells become less flexible. When you dump plain water into your system, it can temporarily dilute your electrolytes and fail to trigger the blood vessel relaxation you need for proper flow. This is why so many seniors drink water all day, but still feel cold hands, heavy legs, and that nagging brain fog. I remember a patient of mine, Gerald. He was 68, active, and did everything right. He walked 3 miles every morning and ate his oatmeal religiously. Yet, his morning blood sugar was all over the place, 145 one day, 185 the next. He was frustrated. He felt like he was failing, even though he was trying harder than everyone else. When I asked him about his morning routine, he said he'd wake up at 6:30, check his sugar, and drink coffee while reading the news. He didn't touch plain water until 7:30 or later. That's 9 hours of progressive dehydration. Even a 2% drop in hydration, levels you won't even feel as thirst, can raise your blood sugar by 10 to 15 points. For Gerald, his healthy morning habit was actually keeping his blood thick and sluggish, making it impossible for his insulin to do its job. The H3 method, smarter hydration. To stop this aging habit, we use what I call the H3 method. Timing point number 1, the morning ritual. The moment you wake up, before coffee, before your phone, drink 1 glass of warm water. But here is the trick. Add a tiny pinch of natural sea salt and a squeeze of fresh lemon. Why? After 8 hours of sleep, you haven't just lost water, you've lost electrolytes. That tiny bit of sea salt, the kind with minerals like magnesium and potassium, helps your cells actually absorb the water instead of it just passing straight to your bladder. The lemon provides vitamin C, which research shows can make your blood vessels up to 40% more elastic. Timing point number 2, the 15-minute pre-meal sip. Drink a small glass of water 15 minutes before lunch and dinner. This dilutes your stomach contents just enough to slow down how fast carbohydrates hit your bloodstream. Clinical studies show this simple habit can reduce post-meal blood sugar spikes by up to 20%. Timing point number 3, the magnesium nightcap. 1 hour before bed, have a final glass of warm water with a bit of magnesium dissolved in it. Most people over 60 are clinically deficient in magnesium, which is crucial for insulin function. This habit helps your muscles relax for deeper sleep and keeps your blood sugar stable through the night. When Gerald switched to this method, his morning readings dropped by 22 points in just 1 month. No new medications. Just changing how and when he hydrated. The way you sleep is taxing your heart. While we're talking about habits that age you, we have to look at the 7 to 9 hours you spend in bed. That is 1/3 of your life. Most people choose a position based on their mattress or their neck pain, but your heart has a preference. Anatomically, your heart sits slightly to the left of your chest. When you sleep on your left side, gravity actually assists your heart's pumping function. It's like the difference between pushing a cart uphill versus slightly downhill. But it's more than just gravity. There is a massive vein called the inferior vena cava that returns blood from your lower body to your heart. It runs along the right side of your spine. When you sleep on your right side or your back, you can actually compress this vein, making your heart work harder to maintain circulation. By simply rolling onto your left side, you reduce the workload on your heart, improve venous return, and clear waste from your brain more effectively through the lymphatic system. This isn't a secret. It's basic vascular physiology that can reduce your risk of the very things we fear most: strokes and blood clots. The healthy breakfast, that's spiking your sugar. We've all been told oatmeal is the gold standard for seniors, and it can be. But for many, it's a metabolic disaster in a bowl. The habit that's aging you here is the lonely carbohydrate mistake. Even if you buy the best steel-cut oats, if you eat them plain or just with a bit of fruit, you're eating 90% carbohydrates. Without protein or healthy fat, those carbs hit your system, spike your sugar, and then cause a crash by 10:00 a.m. that leaves you ravenous and foggy. After 60, we are fighting sarcopenia, the natural loss of muscle. Between ages 70 and 80, you can lose up to 15% of your muscle mass in a single decade. Missing the opportunity to have protein at breakfast is like giving up a key battle for your independence. My golden formula for oatmeal is simple: oats plus protein plus fat. Add a scoop of Greek yogurt or protein powder for your muscles. Add walnuts or a tablespoon of almond butter for healthy fats that slow down digestion. And please stop adding just a drizzle of honey or brown sugar. Your pancreas doesn't care if the sugar came from a bee or a cane. It just sees the glucose and triggers the inflammation we're trying to avoid. The perfect number that might be dangerous. This next part is hard for some to hear because we've been conditioned to chase a specific number: 120/80. If you are over 75 and your doctor is celebrating that your blood pressure is exactly 120/80, you need to be careful. A study of 15,000 seniors found that those with perfect blood pressure actually had a 28% higher risk of serious falls. As we age, our arteries stiffen, a process called arteriosclerosis. We actually need slightly higher pressure to ensure blood reaches our brain and kidneys, especially when we stand up against gravity. The research now suggests that for those over 75, the sweet spot for longest survival and best quality of life is actually between 130 and 145 systolic. When we push the pressure too low with multiple medications, we risk orthostatic hypotension. That dizzy spell you get when you stand up, that split second of dizziness, is your brain starving for blood, and it's the number one precursor to a fractured hip. The medicine cabinet. A silent threat to your brain. We trust our doctors and we trust our pills. But polypharmacy, taking multiple medications, is one of the largest contributors to rapid cognitive decline in seniors. There is a class of drugs called anticholinergics. They include things as harmless as Benadryl for sleep or medications for bladder control and acid reflux. These drugs block acetylcholine, the chemical your brain uses to form new memories. One study found that seniors taking these medications had a 54% higher risk of dementia. 99% of seniors have no idea that a pill they take for heartburn might be shrinking their memory centers by 28% in less than a year. If you're feeling brain fog or unexplained forgetfulness, don't just blame it on your age. It might be the cumulative anticholinergic burden in your medicine cabinet. Your brain is incredibly resilient, but it can only heal if you remove what's harming it. The 30-second foot check. Finally, I want to talk about your feet. They are the furthest delivery point from your heart. Because of that, they are often the canary in the coal mine for your overall health. Are your feet always cold, even under 3 blankets in July? Do you have cracked heels that no moisturizer seems to fix? Have you noticed that the hair on your lower legs has started to disappear? These aren't just skin problems. They are signals. Cold feet often mean your pipes are narrowing from blood sugar damage. Cracked heels can be a sign of autonomic neuropathy, where the nerves that control skin moisture are struggling. Hair loss is a visible marker that your follicles aren't getting enough oxygenated blood. Tonight, before you go to bed, I want you to sit down and truly look at your feet. Check between the toes for any small wound that won't heal. If a blister takes more than 48 hours to show improvement, that is a distress signal that your circulation needs help. Taking back control, we've covered a lot today. It can feel overwhelming, but remember, you don't have to change everything at once. Aging is not a death sentence or a mandatory decline. I have patients in their 80s and 90s who are vibrant, sharp, and active. They aren't genetically lucky. They are people who learned to listen to the quiet signals their bodies were sending. Start with one thing. Maybe tonight you roll onto your left side. Maybe tomorrow morning you have that glass of warm water with a pinch of sea salt and lemon. You've worked hard for the life you have, for your independence and your health. Don't let a few simple, fixable habits take that from you just because nobody told you what to look for. If you found this helpful, I want to ask you to do something. If you've noticed even one of these signs, the dry mouth, the cold feet, or the afternoon fog, go to the comments right now and type the word Wes. I read every single comment on this channel. It helps me know that this message is reaching the people who need it. And if you're committed to trying the H3 method or making one of these changes, type I watched till the end. It tells me you're serious about your health trajectory. Share this with someone you love, a spouse, a sibling, or a friend who's been complaining about just getting old. You might be giving them the information they didn't even know they were missing. I'm here to help you stay sharp, healthy, and strong for all the years ahead. I'll see you in the next video. Until then, take care of yourself and take care of those feet